Hi everyone, my name is Nerea Francis, and I am really excited to introduce to you dance movement therapy. I chose this technique because I currently am a dancer and I have danced for 15 years, and I feel that incorporating dance throughout my life has really helped me express myself in different ways that I have not been able to express myself before. I feel that using your body to express your emotions and your feelings is very relaxing. It's helped me relieve a lot of tension and anxiety and kind of keep myself grounded. And I feel that introducing these techniques to other individuals may help them as well. Dance movement therapy is a very powerful facilitation technique that uses movement and dance to support emotional, cognitive, and physical well-being. Today, I will share with you the history, purpose, theoretical foundation, and its effectiveness for 3 specific populations. We will also dive into a short demonstration of how to implement these techniques and adapt it to meet individual needs. Dance movement therapy involves structured or improvisational movement designed to promote physical and emotional healing. It focuses on nonverbal expression, allowing participants to explore emotions, improve body awareness, and strengthen the mind and body connections. Therapists may facilitate these movements, ensuring that they are accessible and meaningful for participants. So, the purpose of dance movement therapy is to improve physical mobility and coordination, especially in populations with certain motor challenges. Dance movement therapy can also provide a safe space for emotional expression and interpersonal connections. Dancing as a community is a very helpful way as well. Dance movement therapy bridges the gap between movement and mental health, making it highly versatile and effective. A little history of dance movement therapy. Dance movement therapy has emerged as a formal practice in the 1940s, pioneered by Marianne Chase. She was a professional dancer who recognized the therapeutic power of dance. She noticed that patients in psychiatric hospitals responded positively to movement-based interventions. And over time, her work and that of others like Mary Whitehouse and Trudy Scoop shaped the field. In 1966, dance movement therapy became officially recognized by the American Dance Therapy Association. Today, it is practiced worldwide in hospitals, schools, community centers, and private settings. So, the theoretical foundation of dance movement therapy. Dance movement therapy is grounded in several theories. One theory being the body and mind's connection. This is the belief that physical movement directly influences mental and emotional states. Another theory is the nonverbal communication. Movement is considered a primary form of expression, especially when verbal communication is limited. And the third theory is psychodynamic theory, where movement is used to access unconscious emotions and experiences. These foundations can make dance movement therapy a holistic approach to therapy. So let's explore how dance movement therapy is effective across 3 populations. One population being individuals in the autism spectrum disorder, with autism spectrum disorder. Research shows that dance movement therapy has helped individuals with autism by improving social skills, enhancing emotional regulation, and fostering nonverbal communication. A 2020 study in Frontiers in Psychology found that dance movement therapy interventions significantly improved empathy and social responsiveness in children with autism. For the second population, we will talk about older adults with dementia. With this, dance movement therapy can help reduce agitation, increase social engagement, and enhance cognitive function. A 2019 study published in Aging and Mental Health demonstrated that dance movement therapy sessions decreased symptoms of depression and improved overall quality of life in individuals with Alzheimer's disease. For the third population, we will be talking about with individuals with PTSD, post-traumatic stress disorder. Dance movement therapy has proven to be effective in reducing trauma symptoms and improving emotional resilience. Studies have highlighted how rhythmic movement and improvisation can help release stored trauma from the body. According to a 2021 review in trauma psychology, veterans participating in dance movement therapy have reported decreased anxiety and improved mood. These studies help illustrate the adaptability and the impact of dance movement therapy on these populations. Now I will guide you through a simple dance movement therapy session, which is designed for emotional regulation and body awareness. You can follow along, or you can watch how I guide. So we will start with a warm-up. Let me stand up. So you will start with grounding movements. Gentle. You can start with gentle tapping of the feet. You can also you can tap your shoulders while tapping your feet at the same time. Another good warm-up would be swaying side to side. You can do these movements while using calm music in the background. This can help encourage participants to notice how their body feels and how their body is reacting to the music. I will also ask participants how their body feels throughout the movements, if they feel the wind brushing along their skin, if they feel their hair moving side to side, if they have any senses that are incorporated in these movements. So now for the main activity, we will be using a mirroring technique where participants copy simple arm movements as I demonstrate. This can promote connection and focus. So some arm movements could be bending of the arm, bending of the other arm, and maybe switching, straightening one arm up and straightening one arm down, and then bringing it into a big circle in front of you. Same thing with the other arm, bring it up, other arm is straight down, and another big circle right in front of you. You can also open your arms out to the side. Try to bring them as far back as you can, opening your chest, and then bringing your arms in front and caving your chest in as much as you can. Then, for the last activity, I will introduce improvisation. So I will ask participants to create their own movements in response to the music, such as I will say things such as show how the music makes you feel. I can also ask participants if they feel comfortable, they can close their eyes and stay in place and just move their arms around in place. I can also incorporate different scenarios like walking on water. What would that feel like? Walking on grass, how would that look or how would that feel? Walking like a rubber band with that stretching and bringing it back, stretching, bringing it back. What type of movements could individuals incorporate with those scenarios? And that is the end of the activity. Here are a few adaptations for the populations we discussed. So for individuals with autism, I would feel it would be best to keep instructions simple and use visual prompts. For individuals with dementia, you can use familiar music from the participants' past to evoke memories. And for PTSD, you can ensure a trauma-informed approach by creating a safe, non-judgmental space and avoid triggering music or movements. Dance movement therapy is very flexible, and these adaptations ensure its benefits are accessible to everyone. Thank you everyone so much for exploring dance movement therapy with me today. I hope this presentation inspires you to consider the profound impact movement can have on emotional and physical well-being. Remember, dance movement therapy is about connection within ourselves and within others as a community. Thank you so much. Have a wonderful day. Bye.